Jake, he is 6 years old. He was diagnosed with Duchenne Muscular Dystrophy at the age of 4.
His caregiver is his mother and father, and they help spend a lot of time aiding with Jake and his disability.
Because of Jake's disability, dental hygiene considerations need to be implicated into his care. Dental hygiene considerations for persons with muscular dystrophies include impaired motor ability, potential need for body stabilization, and some types do involve orofacial muscles, but the Duchenne type does not.
Many patients with Duchenne arch their back and attempt to find the center of gravity. So offering patients a pillow to place in the middle of their back region may help the patient feel comfortable if we're transferring them to the dental chair or even if they're in their own wheelchair.
Later in life, there is progressive muscular wasting. Eventual involvement of the shoulders can affect optimal oral hygiene. Weakness of respiratory muscles may contradict dental hygiene care such as ultrasonic and air polishing use.
The extra size and weight of a handle of a power-aided device can be difficult for those who have limited strength. So for patients with limited shoulder or elbow movement, lengthening the handle of the brush using a material strong or rigid enough can provide sufficient lateral pressure to remove biofilm from the tooth surfaces. So right now we're going to use toothbrushes to try to make a lengthening device. You could also use a tongue depressor, but this is all we have. And we're going to cut the head off of one. And you're going to attach them with tape. So you attach the two handles. And just make sure it's sturdy enough to where they don't fall or move. And that's how you make a toothbrush.
Recommend the use of a soft toothbrush in the circular phones method along with the circular brushing technique. This may be appropriate and within the capabilities of certain patients. So here we have the lengthened toothbrush that we made. And with the circular phones method, you're going to brush in a circular motion. This will be easy for the patient, but you want to just make sure that you're getting along the gum line as well. A lot of patients forget to brush there. And with the circular brushing method, you're going to angle the toothbrush at a 45-degree angle and put moderate to light pressure. And that's going to allow the bristles to get right underneath the gum line. And you're just going to do a soft back and forth motion. And you're going to go around the teeth. When you get to the anterior teeth, which is from canine to canine on both sides, you're going to turn the toothbrush to a vertical angulation, and you can brush a lot better in this area. The caregiver could use an electric toothbrush to aid in plaque removal. Patient and caregiver need to be instructed to brush twice a day after breakfast and dinner for at least 2 minutes, and instruct to not drink or eat anything other than water after brushing. It's important to also know to brush the tongue to reduce bacteria and prevent halitosis. The Reach Flosser has an extended handle that would aid the patient with Duchenne muscular dystrophy during flossing when muscle weakness progresses in the shoulder. The caregiver could also use the Reach Flosser because it would allow easier access in the patient's mouth. The Reach Floss handle comes with disposable flossing heads. Flossing removes the plaque in the interproximal spaces and reduces the risk of getting cavities between the teeth and bad breath. So you're going to pull the floss mesially while moving up and down to clean the distal surface of a tooth, or you can push distally to clean the mesial surface of a tooth. This is going to allow the floss to be positioned on the side of the papilla so that we're not damaging it.
His caregivers, his mother and father, they spend a lot. Why do I keep saying
He was diagnosed with muscular. Such as ultrasonic and air polishing use.